Do you get pain on the front of your shoulder? If so, this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to tell you several things that can cause pain on the front of the shoulder, as well as what you can do about it. Now, if you find this video helpful, give it a like or thumbs up, and subscribe to our channel so you can get notified of our future videos. Now, the first thing that most people think of when they have pain on the front of their shoulder is, do I have a rotator cuff problem? And to some degree, probably, but it doesn't necessarily mean that you have a rotator cuff tear. It also definitely doesn't mean that you need surgery. Now, let me explain a couple things about the shoulder joint. The shoulder is a ball and socket joint. So if you picture a golf ball sitting on a golf tee sideways, or a ball in a socket like that, the shoulder joint is like that. And as you raise and move your arm, that ball rotates around in the socket. Now, if you picture that golf ball on the golf tee, if the ball gets off the center of the tee such that it's pinching on the side of the tee, you can pinch other structures, and your rotator cuff tendons run down and attach to the front of your shoulder. So that's one really common cause of pain on the front of the shoulder, is that the ball isn't lined up in the socket and it's too far forward, and therefore it can pinch on the rotator cuff tendons as you reach up in the air, or as you reach up across your body, or even as you reach behind your back as your shoulder tips forward like that. So that's the most common cause of pain on the front of the shoulder. Now, it's also important that you rule out your neck, because your neck can refer pain to your shoulder. Most commonly, the neck refers pain onto the side of the shoulder or even down the arm. So if you have shoulder pain on the side of the shoulder or down the arm, then it's certainly worthwhile getting checked out to find out if it is your neck. And if you do need some help with that, we can certainly help you out with that at More for Life. But let's say that it is a shoulder problem and you're having trouble reaching upwards, reaching across your body, or you're having shoulder pain when reaching behind your back. There are a couple simple tips that you can use to help. Now, usually shoulder pain from a rotator cuff problem boils down to two problems. One is a shoulder blade problem, that the shoulder blade isn't moving appropriately, that as you raise your arm up, the shoulder blade has to move up. As you raise your arm down, the shoulder blade has to come back down. Now, if you raise your arm up and the shoulder blade doesn't go up, you can again pinch those rotator cuff tendons, causing pain on the front of the shoulder. So how do you fix that? Well, if you think about raising your arm, you want your shoulder blade to kind of move up and around your body. It should come in an angle like that, kind of moving up and around your rib cage. So again, think about raising your shoulder blade, leading with your fingertips, reaching up towards the ceiling, allowing the shoulder blade to move up, and then pulling back down with your elbow. Now, it's actually easier to pull your arm down than it is to allow your rotator cuff muscles to slowly ratchet it down. So again, looking from the front, you raise up, leading with your fingertips, allowing the shoulder blade to kind of move up and around your body, and then pull your elbow back down in order to bring your arm back down. And that will help you with pain on the front of the shoulder when you're reaching above your head. Now, let's say that you have pain on the front of the shoulder and you try raising that arm up and it doesn't help. What do you do then? Well, the other thing about the shoulder joint is that it's a ball and socket joint, but it's not a perfectly round ball. That ball has bumps on it, and depending how you rotate that ball, you can pinch or not pinch the tendons in your shoulder. So if your shoulder is rotated this way with thumb down, that rotates the bump on the shoulder inward, and you can pinch on the socket. So an easy way to fix that is turning thumb up for success, thumb up, versus thumb down. So leading with your fingertips, thumb up, not going up like that, or leading up with your elbow where your thumb is down. So remember, thumbs up for success. Now, what about pain reaching across your shoulder? Again, shoulder blade problem, shoulder joint problem. One problem is that people try to make the axis of rotation here, going like that, and again, you can pinch tendons on the front of your shoulder as you come across your body. So rather than just moving at the arm, you want to allow your whole shoulder blade to come across the body. Now, that's problem number one. Problem number two is that if you do thumb down again, you're going to rotate the ball such that you're pinching the tendons of the rotator cuff as you reach across your body. So that's problem number 2. Now, so that's reaching across your body. The third problem that people with shoulder pain commonly have is reaching behind their back. And again, there's a shoulder blade problem and there's a shoulder joint problem. If your shoulder blade is tipping too far forward, like this, when you reach behind your back, it brings the arch of the shoulder down. And again, you can pinch the tendons on the front of the shoulder. So how do you fix that problem? Don't let it happen. Keep your shoulder up, pull the shoulder blade back around your body rather than tipping it forward like that. Now the shoulder joint problem, that the ball is gliding too far in the socket. And a lot of times that's because of stiffness in the back of the shoulder. Now there are exercises that you can do for that. I've got a video on how to do the sleeper stretch properly, which is a good stretch for the back of the shoulder. You can also use a tennis ball or a racket ball or one of the massage balls on the back part of the shoulder where the rotator cuff muscles are, and that helps loosen up those muscles. But let's say you're just actually doing the process of reaching back. If you think about moving, like rotating around this axis so that the shoulder is not coming forward in the socket, that will also help you not pinch and not have shoulder blade or shoulder pain when you reach behind your back. So again, don't let the shoulder blade tip forward and rotate around an axis without allowing the ball to glide forward in the socket. So those are some tips to help you if you have pain on the front of the shoulder. If you found this video helpful, give it a like or thumbs up and subscribe to our channel so you get notified of our future videos. Thanks and have a great day.